bone meets heart. Okay, when you see the images, you will know, or when you learn about the history, you will know why it is called this. It's the history of a 59-year-old male from Chechnya. She was injured during the Chechenian War. That was part of her medical history. And then later she developed an osteosarcoma of the left tibia and was operated in Chechnya. And she fled Chechnya and came to Austria and was brought to a hospital here. And when she arrived, she had a very large wound on her tibia, which seemed to be infected. And there was a chest X-ray where there was a suspicion of a mass and of and bronchi, and the first hospital that saw her was kind of in doubt if she really had an osteosarcoma. And with this diagnosis, she was brought here, and to the orthopedic ward. We have a fairly large tumor center here, but on the ward she developed atrial fibrillation, and that's how she came into our hands. Now, I will show you the image now of her echo, because the question to us was if we should perform cardioversion on her. And since she also complained of dyspnea, we wanted to see what her left ventricular function was like. Now, these images are not very good. I must apologize, but she was just not easy to image and a bit obese as well. So you can see that she has atrial fibrillation, very rapid heart rate. She has a bit, well, not very much, but maybe a bit of regurgitation. It's very difficult to see because her heart rate is so high, but this is not the main finding. The main finding is this here. Okay, you can see that something is going on here. And if you go to the 4-chamber view, I think it's apparent that she has a problem. Do you all see the problem? Okay, well, this is her problem. There's a fairly large mass here. And look at the motion of the heart, a bit of mitral regurgitation. It's very rapid because she has atrial fibrillation. I'll show you another image. Importantly, take a look at the mass as well. Okay, let me just measure this so you get a bit of an appreciation how large it is. It probably comes from somewhere here, but at least this is a diameter of 14 centimeters. I guess it would be probably larger because we don't have the entire mass here on the screen. Okay. If we use a 2-chamber view, we can see the mass right here. And again, a 4-chamber view. Okay. Okay, now I want to ask a question. This is the apical long axis view. And the question, now obviously there's a structure. I think you all see it, but where do you think the structure is? I'm asking this question because in your report you will have to put a location. You will have to describe the mass. And do you think it is on the pericardium? Do you think it is intrapericardial, within the pericardium? Do you think it is a mass of the lung? Is it attached to the pleura? Or, I mean, who cares? You have to take it out anyway, and the surgeon will find it. What is your opinion? Okay. Okay, I'll close. Well, 65 of you. Well, I'll give you maybe 10 more seconds. So if you want to vote, vote now. Okay, I see there's a question. There's a need for CT. Yes, there is, and I will show you the CT later. Okay, now let's close the poll. What are your answers? I would say a pretty even distribution. Honestly, it's very difficult to say where the origin of the mass is, because we can only say that it is lateral to the left ventricle and anterior to the left ventricle. So it must be very close to the chest. It does not really look like it's interpericardial because we do not have pericardial effusion. In this case, we would usually see some degree of pericardial effusion as well. It could be in the lung, but again, if we have something in the lung, we would probably also see some pleural effusion, or it would look maybe a bit different. And now here are the CT images of the patient. This is the mass. Okay, so clearly it is located lateral, right close to the chest here, and it is almost touching, or it is actually touching the ventricle. The pericardium is here, so it's outside the pericardial sac. Okay, here is another view of the CT. You see it is not at the base of the heart, but it's more towards the mid and apical segments of the heart. Okay, and the dignity is most likely malignant. The patient had osteosarcoma, remember, and the first thought would be that it is some form of a metastasis of the osteosarcoma. And the proof that it truly is malignant is seen here in the PET scan. The PET scan glows if we have malignancy, and this is nicely depicted here. And there is also something glowing here in the lung, which turned out to be another metastasis of the patient. Here is the PET scan. The mass is seen right here. This is the huge mass. It's almost as large as the heart, actually. So, very big mass. Histology turned out to be truly a metastasis. It was the histology of osteosarcoma, and she was operated and is now recovering actually quite quickly from the operation. When you look at extracardiac masses, here are some things that you kind of have to consider. Tumors which are not within the heart can either be located in the mediastinum, they can be located on the chest wall or be part of the chest wall. They can be tumors of the lung, they can originate from the pleura, and that was where the tumor actually originated. I forgot to tell you this, so it was a pleural tumor. It could also be a tumor of the esophagus as well. So these things are very difficult to really differentiate with echocardiography, and usually you need CT. Another thing you have to consider is that some structures might mimic tumors. For example, a pleural effusion, especially if there is a fibrinous pleural effusion, could sometimes look like a tumor. A hiatal hernia could look the same, and even aneurysms can sometimes appear as if they are a tumor. Cardiac involvement is something you have to look for in these patients. Is there infiltration? Is the heart in some way affected by the tumor? In this case, I had the impression that the motion of the heart was impaired because of the tumor. Maybe this was the reason she developed atrial fibrillation. Compression of the large vessels or compression of the heart is another thing that you must be considering. And here are just some examples. This is a patient who had a large tumor. Let me go back to here, right here, very close to the great vessels, which led to some degree of compression here of the inferior vena cava. So this is something that would be a complication of an extracardiac tumor.